COVID is kind of ever changing, I guess. It's kind of changed a little bit. Has anybody had any experience this year with COVID and basically medical stuff going on? Maybe your own medical stuff, maybe stuff dealing with children, pregnancy, that kind of thing. So there, let's start from there. Let's go from experience wise of what we've gone through and what's changed that's different than doing these things before.
Well, I got a lot of that, I guess, because I had a baby in October. So this baby was very planned. It was an embryo adoption. So we went to do a transfer and we actually flew to Florida. I live in Ohio, and it was in February, and I hadn't even heard of the virus when we did our transfer in the middle of February. And it was when we got back that, but I guess March, that it started being in the news, and I'm hearing about it, and I'm thinking, wow, I'm glad we did that then, because I wouldn't want to travel now. And then as it got worse, I thought I wouldn't have done it. I still wouldn't. I would still not be comfortable flying and going and doing something medical on purpose like at this juncture. So I'm glad that we did it then, because it was right before then. But it was very different than my other 8 children I've given birth to. It was very different. The hospital policy is only one person in the hospital. So only my husband could be in there. And every other birth I've had multiple support people, at least my husband and a one other female, at least. But generally there's more than one other female. So it was very different, because it felt like it was just me. Kind of, my husband's great, but it was a very different experience doing that. And the whole pregnancy was anxiety ridden and lonely and just very different than any other pregnancy because of the virus. So, and postpartum, same thing. There's nobody, you can't go to postpartum, you can't go to mom groups, you can't, hang out with other moms, you can't, it just feels like very lonely in that hormonal time when you desperately need other women and there's not any to be had because you can't see anybody.
Now, were you allowed people at your doctor's appointments, or did you have to go to all of that alone? And how did that make you feel?
I did all of them alone. The fertility clinic, like when I was still under their care, they wouldn't have allowed him to go there. And my OB didn't allow it for a long time. And at the point at which they finally said, oh, okay, he can come, they were the checking the baby at the end, because I have high risk pregnancies. At the end of the pregnancy, once a week, I would go in to get an ultrasound to check the baby. And they're like, oh, by the way, we'll let you come in and we'll let you bring your husband and he can come. And I'm like, there's only like 3 more ultrasounds and he's going to be born. And he, he's working. And it's like all the big ones were he wasn't allowed to be there. So.
Now, can I ask a question about your birth? So do you think, because you've had other births in the hospital, do you think the medical staff was shortened, or there wasn't as many medical people for your birth this time? Or do you think it was about the same?
Well, I'm in a different state than I've birthed before, in a different hospital. So I don't think that there were less people. I mean, I had one nurse the whole time, and I think that it's the hospital policy always to do this, but they had where only the residents would come in to do anything. The nurses don't check you; they don't do anything medical. The residents do, and the attending only shows up when it's time to give birth, which I did not know prior to showing up at the hospital. Like I'd seen the same doctor the whole pregnancy, and I was induced to be so that she could deliver me. And then I find out, oh, they're like, you're not going to see her till the end. And I'm like, she's here. Why can't I see her? So I had all these, like a group of residents that would come in each time, like 3 or 4 of them. And I finally got tired of them and told the nurse they weren't allowed to come back in. And if they wanted to tell me anything, they had to send the attending in because they were ridiculous and they weren't listening to me. And I really don't know. I don't think it's a COVID policy. I think it's just the way this hospital is. So it's hard for me to tell. I would have to tell you if I had birthed there before, but I hadn't.
Liz, can I ask you a question? I'm wondering, for those who are maybe newly pregnant or midway through their pregnancy, or maybe they're even people who have given birth with a lot of people around before, like the experience like you've shared where you've had multiple support people, and they're kind of fearful going into a delivery where they're going to be limited on their support people in the hospital. If you had advice that you would give, or one kind of little words of wisdom that you would share with them, what would you say to those people?
I planned to have my best friend like on FaceTime the whole time, and that would have been great. But I didn't start hard laboring until it was like really late, and she was probably sleeping. And so that didn't end up working out. I think had it been like my sister, I don't have a sister, but or something like that, it would have been fine. And I would certainly, I FaceTime all the time. I would have been comfortable with it, but I just never ended up doing that. I just kind of just went into my own zone with just, I don't know, it was just me. It was like a journey, like, I don't know that I have any advice. I would try to come up with a way to do like FaceTime or something. And I really like my nurse. So that was nice. I think that if at the beginning you don't like your nurses, I would ask to change nurses because I would not be afraid of that. I've learned throughout my many medical kiddos that I have, if you don't like a nurse, ask for a different one because she's going to be the person that's going to be kind of your support person. Like my nurse was really sweet. She ended up delivering my baby because the doctor didn't show up in time. So I'm glad I really liked her. So I think that if you don't like your nurse, you should change nurses.
Now, I'm just curious, but has anybody else had any experience, like she's had birth and had to go through her pregnancy, dealing with all the stuff that's going on with COVID kind of before, and then it fell into that. Has anybody else had any problems with appointments or anything else going on maybe with your children or yourself? Because I know I have. I know I personally have experienced, it seems to be harder to contact them. Like when you're trying to get a hold to even make an appointment, it seems like you're almost jumping into more hoops than you did before. There's a lot more waiting periods and also like a big gap of time. Like instead of something that maybe you would see maybe in a week or a month, you'd end up seeing like, well, you're going to see them next year pretty much because they're so booked. And I don't know what happened with you guys with any shutdowns or anything medically if things stayed open. I heard some places, some states, and even some offices did like half hours. So they were only open from like 8 to like noon, and their afternoon hours they cut, and it was kind of crazy for a little bit of even just getting regular doctor appointments with regular doctors. So I'm just curious if this was happening in other places or just like what was happening here in a big city.
So we had something, my daughter had a dental emergency and I called. I did not know it was going to be so hard. Called multiple dentists that were actually shut down. And they said if it got bad enough to go into the ER. And then one was actually able to just meet me in the office because I think at the time, I don't know if it was nationwide or statewide that that the dentist offices were shut down. So the dentist was able to come in and just the dentist and a hygienist to help at the time. So that was something that we didn't expect at the time. And then my husband he ended up having a tonsillectomy. And that was a little bit different and hard to schedule around all of the shutdowns and everything. So we were kind of put on a waiting list for a bit. And then once we were able to open up, they got him on the schedule pretty fast, but it definitely is different. I'd say the one positive I like is with pediatricians. Whenever I took in my kids, because I have one asthmatic son, it was always hard. We have to go and sit in the sick office, and then he might not be sick, but we're being exposed to all these germs. I really like that we're allowed to stay in our car now, and like they come out and get you, so you're not being exposed to everything else. That is one of the positives, and I hope that's going to be here to stay. I do enjoy that. Other than that, that was pretty much all the experiences we've had medical wise.
I know with my child, before everything got shut down here in March, he'd had some problems hearing, and we'd gone to his well child appointment. And they said, well, you need to schedule another hearing test for him. And I said, okay, let me do that. And that was middle of January. And then we tried to, I think it was 6 weeks out, they wanted to do that anyway, just to give his ears some time to clear up. He didn't get to go to that appointment. And we still have not been able to get him in for a hearing test because our numbers are back really, really high. He's been out of school since March. So I guess he's hearing okay now, but I don't know if there's a problem. We haven't been able to get it checked out.
See, and that's something that I'm noticing personally is that whenever there is an issue, like not just your normal appointments, it seems to be a little bit harder trying to get in places because I had some medical stuff going in. I didn't know what was going on. And I'm like, okay, well, I have to wait a month to see the doctor. And then by the time I get in, I had like so many things going on. I didn't even know hardly what to tell the doctor. And then they're like, okay, we're going to do blood work. We're going to do this. We're going to do this. And we're going to do all these testing. And then you have to schedule the testing. It wasn't just like you leave and you can go to like Quest or go to some place and just immediately get whatever. And also they were doing like different capacities. So you'd go and it's like, oh, only 5 people in here, different things like that. I do like the thing about where you can go to appointment and you basically check in, or sometimes they have a number and you just call the number and say, hey, I'm here to check in. Or you go inside, maybe they see you like, hey, whatever. And then you can go out to your car and they can call you. I was like, that's really cool. I think that's great. Cause then you sometimes sit in the lobby just waiting to go into the doctor for half an hour or something or longer. And it's like, I don't want to be in there. Like nobody wants to be like sitting in there. Like I could be exposing somebody in the room can be exposing. I was like, we just don't know. It's just safer for me to be in my car. So I think that right there was probably one of the better things that I've seen a lot of doctors' offices do. But it's funny because some of them are like super kind of like nonchalant, like it's normal. Like the only difference is you're wearing a mask. And then some of them, you're getting your temperature checked out. You have to do a form where you have to fill out, have you left your state? Have you done this? Have you done this? Have you been around this type of person? And that to me is kind of interesting because it just kind of depends on the doctor, the doctor office. Is it a specialty? Is it something normal? So I thought that was really, it's really different. And I noticed even the pediatric different ones, like specialty ones, are more like, we're checking your temperature and only one parent can go in with your kid, which can be a very, very stressful because if there's something you're going to get told, you're getting told by yourself. And that right there is like a scary thing. And I'm also hearing about a lot of women online being pregnant and going to their doctor's appointments, going to ultrasounds and finding, there's no heartbeat and they're being told without their partner being there. That's a big thing that I'm hearing right now, which is horrible because just hearing that ever is horrible. And then to do it by yourself, it's very lonely. It's very isolating. And it's just got to be a whole nother level of shock because now you got to go tell somebody. You didn't have like the doctor to be able to tell them. So I am seeing a lot more doctors. If you ask, you can do phone calls where they're on speakerphone, or you can do like a FaceTime or that kind of thing, which is nice because at least it's like filling the gap of you're not just by yourself with appointments. And I think some doctors are starting to see, like, I think they're noticing the isolation that especially women that are like pregnant or with children or whatever, they're going through this stuff by themselves. So they're like, let's try to help them so they have support, which I think is the best thing that we could be doing right now. I think we all need support, but that's kind of a nice option that I'm glad that some people are starting to do. So
my specialist that I went at the end of the pregnancy to go do the ultrasounds, they have a sign up on the wall that says no FaceTime or video allowed. So they're like the opposite of that. But I do want to say that one thing I love, and I hope it continues on, is the ability to do virtual calls with specialists, because I have several medical kids and we see a lot of specialists. And a lot of the times there is no reason for me to be there in person or for my kid to be there in person, because we're just checking in, talking about meds or whatever. And being able to do virtual appointments for those has been amazing, because I'm not driving, I'm not waiting in a waiting room, I'm not taking forever waiting in the room for the doctor. It's just at my house. It's a 10-minute call and then I'm done. And that's amazing. I really hope that continues.
I would agree with that. I was just going to chime in and say, so I do think I had a unique experience kind of at the beginning of COVID, because I live in upstate New York, Western New York, actually. So I'm quite removed from New York City, but the state kind of had these resounding universal precautions. So while it was somewhat actually prevalent in my part of the state to a degree in March and April, it was nowhere near what was happening in New York City. Obviously, New York City, it's where it hit in the forefront of everything. And it was kind of the place in the United States that it hit first and hit horribly. So our state under Governor Cuomo had kind of universal restrictions quite early. So I'll say one thing that was really stressful and a negative that happened early on was around March 24th. My grandmother had a stroke, and her access to care for her was really difficult, because they really had to kind of weigh out the benefits of her getting care in a hospital or getting these access to care and the potential for her to catch COVID. It was so new at that point. So, trying to decide at that point, they were having difficulty, especially in the areas that were having COVID, they were having difficulty managing the spread of it. So amongst the hospital wing, it would just wipe out a whole wing, and they were having difficulty accessing PPE and all of those things. So ultimately she was having to receive a lot of care over Zoom, and getting guided instruction from physicians to my aunt, to my mother, who were then caring for her as lay people who have no medical training. And so that was really stressful. She was kind of, this balance of how to provide care for her was really stressful. So she's this otherwise healthy person who unfortunately had a stroke right in the beginning of COVID. She's about to turn 93 later this month. And it was just one of those really stressful situations. So that was difficult to navigate early on. But I will say, to second what Liz was saying, I do appreciate, I've had a few times now where I've had telehealth visits that I really appreciate. I like that MyChart has added this feature that didn't exist before, where you can upload pictures and things like that you could never send. But sometimes it's just can you just look at my kid's rash? Because I don't need to come in I'll just show you what the rash looks like. So I do like that. And I appreciate that end of just being able to avoid the office for things that, for both the physician or their office and on my end, it could just go so much quicker. You can still bill my insurance. We can still call it what it is, but please, let's just figure this out without having to come into the office, without having to expose us, you, whoever else, to anything else. So I do appreciate that piece of it.
Well, I can tell you that at the beginning of this, right when we were hearing about it, but it hadn't hit us yet. Our son broke his bone and we were hearing about it, and we were we didn't want to take him to the hospital. You don't want to, because you're we don't know what it is. We don't know how bad it is. And you definitely don't want your child to get it. At this point, we didn't know all the things that we know. And I was oh my God, if my kid gets this because he broke a bone and we're just trying to take him in to get care kind of thing. But we didn't know he broke a bone at the time, just so you know. He was wounded, and I was something's wrong. We need to take him in. My husband was if you feel something's off, and I was yeah, he's crying in a certain way that it just feels like something's off. So we did go in and found out he did break a bone. But when we first went in, it was we were very scared. We were scared to walk inside. We were very scared to bring him inside. And then it was it wasn't bad at all. We went right in, they put us right in a room right away. We said the doctor right away, they did x-rays, everything was really fast. And I think part of it was everybody was so new. They were kind of rushing us in and out because they just, you know what I mean? Like at the same time, they were like, we don't know if they have it either. So we'll just get them done and then bye, you can leave, you know? So I think that was part of it. But I can tell you, we had to set up an appointment and I was like, oh, we're never going to get in with a specialist. And they did we actually got in like pretty much the next day I called. They were like, the next day we were getting in because he's young. And I was like, okay, awesome. And we went and we asked them because it was the pediatrician for bones, basically. We were like, should we be worried? Like, cause he was like, you're going to have to come back and, you know, whatever. And I was like, should we come back? Like, should we keep you? And he was like, yes, you should come back. Let me do another x-ray, you know, whatever. And I was like, okay, well, you know, will you call us if this changes? Because we just, at the time, we did not know anything. And he was like, yeah, if anything, whatever, we'll let you know. And then when we went back, when it was time to go back, they did the one person go in. So I went in, and which my husband was working anyways, but I brought my mom with because I didn't know how he was going to do with x-rays. He's 3. So we went in and they checked both of our temperatures, his too, and they had us wait outside. They say you can wait outside or in the car. It's nice here, and it was nice at the time. So we were just outside really quick, and they literally no contact. You didn't pay your bill. You didn't anything. They were like, we'll bill you later. You don't have to sign anything. They literally had us go right back to the room. You know, we're in masks. Everybody's in a mask, and the doctor comes back, checks him out, and he was like, can I feel him? Like he asked my permission. Can I feel? And I was, well, yeah, you're the doctor. That's why we're here. It's for his bone. So he like checked him out and he was like, okay. But he was like, very like, okay, we wash your hands and, you know, whatever. And I was like, okay. So it was just a completely different experience. Cause normally, you know, especially pediatricians they're like hands-on with your kid. And here they are like, do you mind that I'm gonna touch your son? You know, it was
so they
way
decided
different.
to be appropriate. And that was like, you know, it's amazing what you can do when you put your mind to it. Like, we don't have to have everyone waiting in a waiting room. We can ask consent before we touch your child. Things like this. It's a good thing.
And you know what? It's funny that you said that because I thought the same thing. The same thing.
So I actually had to visit the ER 4 times in 4 weeks. And it was unusual. It was I was scratched by a bat on my head, and it happened on a Friday night. And of course I'm like, no, I don't need to go. And then Google told me I would die if I didn't. So I had to go in. I went in on Saturday morning. And so it's rabies post-exposure prophylaxis, if I said that right. And the first set is a set of shots, and then you have to come back. There's certain days, and it always ended on Saturdays. And because it was a Saturday, health departments aren't open, and doctors' offices don't carry these rabies vaccines that you need. So I ended up having to visit the ER, in the same ER. This was in August, but I would say they had a lot of precautions in place, and I felt like, of course, I was just in there for something simple. I had to see a doctor, but they just kind of came in and said, is everything okay? But a lot of precautions be in place. So I was pretty comfortable. I was not comfortable going into the hospital just for a shot instead of something serious. I would have rather probably gone into the health department or my doctor's office. And then on the other hand, we've had a death in the family during COVID. October, November, it was my grandmother, not COVID related that we know of, but she went into the hospital, the ER, the only hospital in the area we were at, or she was at, and they were not allowing any support people. So we didn't really know she was that bad, and she got pretty bad. So she actually ended up dying alone in the hospital. But that's something, you know, with COVID, it's a little hard when people, loved ones, and you could go in, but you can't. So I think that's something else, a negative.
And see, that is something I agree with, because we have the people are going in, our loved ones are going in for different reasons, and we can't go we can't go in with them. And I think that's another big thing of when you have children, or like kind of the thing with like pregnancy and stuff like that. What are the women experiencing going in being pregnant by themselves? And if you get sick or you have any issues. And then I'm curious about if anybody knows, like, how did you do your glucose testing and all that stuff? Did you do it in office, or did you have to go somewhere else for office? Liz, what did you have to do for testing? Did you do everything in your office, or how do they?
It was all done either in the office or at the MFMs. Like here, the MFMs, that the maternal fetal medicine perinatologists that they use are in the children's hospital. So the same hospital that I'm at like multiple times a week with my medical kiddos, there's an office there. And that's where I would go for ultrasounds and like if they did like blood work that was ordered by the specialist, then I would go to the lab, the children's lab. But if it was ordered by my doctor, they would draw it at the doctor's office. So I didn't go anywhere. Like I didn't go to any separate labs. They were either the children's hospital one, which is connected to the office, or in the office.
Now, since does anybody else have anything to add before I kind of shift the attention from COVID to something a little bit more that I think needs to be addressed? Are you good? Okay, because
I'm curious. I think Bambi also, didn't your daughter had a baby during COVID in a different hospital than I delivered at? I'm curious what their policies were, if it was the same.
She was only able to have her husband with her, and that was it. She was able to FaceTime and text me, and that was it. I couldn't go to the hospital. I couldn't, all of her appointments, I would take her to her appointments, wait out in the car, hope and pray that nothing had gone wrong in the time between appointments. All of his pediatrician appointments, she has to go by herself.
Yeah, I think some of the protocols are different. I actually went to my dentist and I had an eye appointment, but these are really small offices that they control. You never really waited in the waiting room even before. And my dentist, really ever since the AIDS blood transmission was scientifically proved, they've, gone the full Monty with the, with the PPE. So, I knew I could go to my dentist because they would be totally masked up, and they have a face mask, or like welders almost. And I felt fine. And I'm glad, it wasn't during the height of it, but I guess they figure their population is small. They don't have that many patients coming in. And both of them are older, so maybe they've sort of looking towards retirement and having less patients anyway. I don't know. Never saw anybody there at either one. So I think they are businesses, right? And right now there's no money except for what they can make. So I decided, after thinking about it, I decided to go ahead and go. This wasn't, at the height of it when nothing was known. It was when this was actually just fairly, maybe in the August and September, when we pretty much know it was just the aerosol, and the droplets. So I felt confident, but I can see in OBs usually have, they see how many 8 pregnant women in an hour. That's a lot of traffic, people coming in and out. And I think it's a higher risk group. And so, yeah, that is a whole different ball game, but you also, it's hard decisions. I don't think I'd do a hospital procedure right now if it was elective, but I felt going to these small offices was safe.
I also went and got my teeth checked out and cleaned. I've had an eye appointment. I've done a lot of things, like obviously you have pediatric care. Yeah, there's been a bunch of stuff, and I felt the same. There wasn't anybody in there. It was actually pretty, there was just me. I waited out in the car and then went in, and they have it pretty laid out, even the smaller offices where you're in. So it seems more safe, and they take time in between, also scrubbing up more. I went in to go to the dentist and they made me, before I could take my mask off, first off, I had to scrub up to my elbows for 30 seconds or whatever. And then to take my mask off, I had to stick in a mouthwash, rinse for 30 seconds, spit it out, do another mouthwash, rinse for 30 seconds. I had they had like a protocol of different things. And then, okay, we're going to give you this, we're going to put this on you. So they were very, to stay in business. I think they handle it very, very well. They're very, they're already, to do what they have to do to be inside people's mouths. I think you have to be pretty clean already to stay in business. And then I think with the COVID stuff, I think, at least where I went, it was very, very well managed. They were very good at what they did, of the ladies in the front, who was moving around. I think they did a really good job. And I asked my OB gynecologist about how things have changed. I've been asking her a lot this year because I was seeing her in the summer. Now it's the fall, like winter. And I'm like, how's things changed? And she said, not much has really changed too much, just more of what the hospitals are doing, what they're changing, of only like one person in, one person basically staying the whole time. But for the most part, she said appointments is one person in for the appointments, but she was allowing, after we went through the little height and things were starting to be figured out, she was allowing your partner to come to your ultrasounds, because she was like, I think she just feels better about having, it's a very, kind of a vulnerable situation. It's a time that, it's a celebrated time, but it also could be a scary time for many of us, of like, you just don't know what you're going to be told. They don't know what you're going to find. So it's nice to have the support. So she was allowing one person. She's still doing that. And yeah, it looks like other places are doing similar stuff, where appointments that you're just going to go in, get weighed, get all checked out. You're by yourself, but you can have your partner on video or on the phone, which is nice. I don't know if all offices do that, but I think if people are worried about that, I think that's something to ask with their doctor too. But yeah, I did see some of that stuff, that it's, you have to think of the little people, the little businesses that we want to keep going to. And I think people don't realize they're so small that they're kind of easier to maintain, easier to keep clean. We had our primary care was, they closed earlier so they could deep clean and do all this different stuff. And they had so many rooms where they were putting so much at a time and so many people a day. So I think they're managing it the best that they can. And I think for the most part, they seem like they're doing pretty good, because if anybody's getting any positives of somebody coming in or one of the workers, it's like they're handling it right away. Okay, you're home. This is this. We're going to do this. I've heard of places closing wings of areas when this first was whatever. Somebody's going to we're just going to close this whole area down, deep clean. Nobody goes in there for so many hours, 72 hours or whatever, and then deep clean. So I've heard some different things, of some different stories of it, but some of the people are saying it's kind of, I'm in Vegas. It's kind of pretty much been about the same. It just depends, ER, if you go in the ER, the patient's the only person going in. Nobody's going to go in there, which a lot of times when you go to the ER and you're with the curtain rooms, it's just you back there normally, unless it's a big, big ER. So I think for the most part, that's pretty much about the same, but yeah.
Well, one thing that I've noticed is different, also having a newborn, is that I have other kiddos that are special needs. We go to lots of doctors and specialists, and most of the doctors now are like, well, you can't bring the newborn. I've had 3 kids, one kid had 2 and one had 3 surgeries during COVID. And I can't, the one that happened after he was born, I couldn't take him. My husband had to go because I couldn't bring the newborn. But there's some specialists are okay with him coming along, but a lot of them aren't. I have to drive 2 hours away to a specialist that one of my kids sees on Tuesday. And when I'm making the appointment, they're like, "Oh, did you have the baby?" And I said, "Yes." And they said, "Well, do you have somebody to watch him?" I'm like, "I'll bring somebody to wait in the car with him, because they won't let him come in. So I can only take in the child that's being seen. It's an orthopedic surgeon. They won't let me bring in the baby." And it's that's a whole different world. And I'm hoping that doesn't stick around, because I've always just taken my breastfed baby everywhere with me. And Now people glare at you. I take them to if I go to the store and I have to go to the store, like Wix shopping, you can't do that pickup. You have to go in and do it. And I can't have anybody else do it because it's so complicated. So like I go in, I have him, and I like take, one of these muslin blankets and I have that over him, but I'm still getting glared at, like having him with me, like, what is that thing doing here? And I'm like, I mean, I don't want to bring him here either, but I have no other way to do this shopping, and I have to. I'm sorry, but it's very, very different attitude. Like I constantly have to ask, is it okay if my newborn comes with me?
Now, just wondering, but is anybody else feeling, because it's been going on for so long, and even though we're taking precautions, we're wearing masks, we're staying away from people, we're doing what we're told to do, is anyone else feeling that we're basically getting to a point where we have to live with this? Like this is something like it's a learned, like lived thing. Like we have to get food, we have to go to the doctor, we have to continue living and doing things, but we have to do things in a more precautious, more aware way of like, don't touch your face, wash your hands, stay away from people. Like there's different things. Like, is anybody else feeling that? Because I'm starting to feel like it's going on almost a year that it's been here, that we've known about it. Now we have a lot more information than we knew at first, where it was like, did we need to wear a hazmat suit to go outside? Like, is this like literally like they dropped a nuke on us and we're in trouble? Like it's blowing in the breeze. But now it's like, now we know where it comes from. And now it's like, we do have to stand together. We do have to support small businesses. We have things that, there's other things that's going on. It's like, we have to keep surviving. And part of it is we have to maintain our health. We have to maintain our family's health. We have to take them to the doctor, eye doctor, your teeth, all these things are important. And we don't know how long this is going to be going on. Like we could be on and off with phases and shutdowns for I don't know how long, so that's something that I feel like, I don't know if anybody else feels that way, but it's something we're starting to kind of accept reality, I guess is the new reality.
I think it's really changed. Oh, I'm sorry. I was just going to say, I think it's changed being a parent to a young child, not just doctor's appointments, but I know before all of this, ways for me to cope so I could get out of the house. I could take my child with me and we'd go to the store and there's a little free fruit for kids or a cookie, and it kept them quiet. And we'd do things like story time or, like the little craft things, the workshops, I guess. You could go out and do that. So it gave you more space. You get out of the house safely, you could do something with your child, and you didn't feel like you were just focused at home trying to get everything done in one little bubble and do school with them. And it's just so much. It's so much to be at home all the time with a kid, and your only breaks are trying to do something virtually. It's not enough.
Yeah, I think that is a huge truth right there. It's not enough, and it sucks if you're trying to live carefully. If you're not, I mean, I see people on Facebook that have no cares apparently for, they're just living normal lives, and I'm kind of jealous of them because I like miss all those things. I'm like, oh, that's nice, your kid is in dance and you had a barbecue and all this stuff, but then I know, I'm like, you're the reason that we've got this going so bad. But for me, maybe it's the postpartum hormones or just my personality. I have this like, it's months of being pregnant. The anxiety has built up to the point where I feel like it's almost inevitable that my family's going to get it and somebody's going to die. Like I have so many kids and I have kids with special needs, and it's like this constantly weighty, all consuming anxiety that no matter what I do, somehow my husband has to work, somehow this is going to get brought to my house and we're going to get it. And there's so many of us, somebody's going to die. And I'm just like, and since I've had a baby that died, it's like, I can't get over that. The constant feeling that somebody's going to die. Like, it's going to be my fault because I didn't do something right, like.
And I agree with you, because of when you lose a child, it changes everything. Nothing is the same. Nothing that you will ever do. You will think of when you get in the car to drive, it's different. This could be the last time that I get in my car to drive. This is the last time that I say goodbye to my family. I agree with you completely, because with this COVID thing, especially when it first came out, we really were, what is this? How bad is this? How, like, they told us everybody's going to get it. Everyone's going to get it. And it's going to wipe out a ridiculous amount of people. And it's just going to be, it's going to have long-term effects. Like, we heard like the worst of the worst, which, I mean, losing anybody's terrible, but imagine if we had lost half our population or something of whatever due to a virus. And as when you lose somebody, and especially if you lose a child, it's just a constant worry. If you have living children, you're constantly thinking, I'm going to get this somehow, you know, not on purpose. I'm doing everything I possibly can. And it's going to be my fault. It's going to be my fault that, that I got this. I gave it to my kid. My kid's going to end up in the ICU. I'm not going to be around. There's another thing is I'm not even going to be there when they take my child away to try to save their life, you know? So it's a very scary thing. Or you think, well, I'm older. Maybe I'll get it and they'll live, but now I just left them without a parent. So it's just, the whole thing is, it's a very, very scary situation. So Liz, I do totally understand what you're saying, because we just don't know. And just like anything in life, it takes a moment, and then we're whoever's living with it is who's left living with it.